Stroke can be commonly known as a brain attack, and it is the leading cause of serious long-term disability amongst older adults. Here's some national statistics on stroke. Every 40 seconds, someone in the U.S. has a stroke. In 2016, 1 in 19 deaths occurred from a stroke. This ranks number 5 in the U.S. as commonly causes of death. Each and every year, these numbers grow and become more detrimental. And the best way is to educate our community to lower these numbers. It is up to us as healthcare workers and providers to go out and reach these communities that don't have the proper education and they don't know how to be fast. And what exactly is our FAST model? So our FAST model is an acronym that stands for face, arms, speech, and time. So for face, you could ask somebody or educate them that to look for signs of stroke as far as drooping of the face, ask them to smile. For arms, you can have someone raise their arms up and see if they droop down or can sway side to side and just not balance on both sides. For speech, you can kind of ask them questions, see if they know or are able to get their words out as they would like to. Rather than words is known as aphasia. Sometimes they can't understand either, so that could be a barrier as well. But you would be able to assess that and see and educate the community. And the T is the most important, and that's time. That is the time you call 911 and get to the emergency room. It's the most crucial step, as the longer you wait, the more detrimental the effects are on your long term. 80% of strokes are preventable, and you could reduce the risk of it by these modifiable risk factors. So as far as diabetes, of being overweight, high cholesterol, just not having the right diet, make sure you eat your vegetables. Exercise is very important. Stay active. If you have high blood pressure, that could also be a very trigger for this, and a lot of times goes unnoticed. So checking up with your family doctor, or even just going to get a checkup every once in a while can have a big effect.
Hi, my name is Rodalisa. I'm going to talk about the risk factors of stroke. Well, there are two groups. There are non-modifiable, which means you cannot change. And the other group are modifiables, which means you can take measures to change them. They can be potentially altered through lifestyle changes and medical management or treatment, thus reducing the risk of stroke. 90% of strokes are actually a result of modifiable risk. Okay, let's start with non-modifiable. These are the things that we cannot change. There's nothing we can do about it. First is age, gender, ethnicity or race, family history or heredity. Those are the non-modifiable. The modifiables are things that we can change. And these are hypertension, heart disease, diabetes mellitus, smoking, sleep apnea, metabolic syndrome, lack of physical exercise, obesity, poor diet, and lastly, drug and alcohol abuse. These are the things that we can change. And these are the risk factors of stroke.
Now we're going to talk about stroke prevention. There are many risk factors that are modifiable, and we're going to talk about those right now. Exercise is very important to the prevention of stroke and your overall vascular health. 20 to 25 minutes of exercise each day is ideal. Exercise helps lower blood pressure and control your weight, which are two huge risk factors of stroke. Eating healthy. Eat 4 to 5 servings of fruits, vegetables, whole grains, poultry, fish, and nuts. A great way to get your fruits and veggies is to make a smoothie. You can drown out the taste of those nasty greens. Avoid sugary drinks, processed meats, and fast foods. Cap sodium intake at 2,000 milligrams per day. Healthy cholesterol levels. Keep cholesterol below 200. HDL levels should be over 60, that's the good cholesterol, and LDL levels should be less than 100. Manage blood pressure. This is probably the biggest risk factor for stroke. You want to keep your blood pressure at or below 120/80. To help maintain a healthy blood pressure, you want to avoid these 4 deadly S's: stress, sodium, smoking, and sedentary lifestyle. You also want to reduce your blood sugar. Fasting glucose should be less than 100. Fingerstick glucose for diabetics should be between 80 and 120. And then last but not least, a no-brainer, no smoking. Nicotine narrows blood vessels. It's the worst thing you can do for your health. So quit, don't start, no-brainer. All right, thank you so much. On to the next one.
Hi, my name is Aisha. I will be talking about signs and symptoms of stroke. We can see a person can present one of these signs or all of them. So let's see if we can recognize somebody who's having off balance, somebody having some difficulty seeing, or the person can have some facial unequal, like not symmetrical. If the person having difficulty talking, or if we see those signs, we need to act fast so that the person can get the TPA, that medication that can prevent prevent person from having some disability. Let's see if we can identify that on a person. Hi, what's going on? Can you lift up your arm for me? Can you smile? Can you read this for me? Can you tell me what's going on? I think you're having a stroke. Let me call 911 for you.
Well, being 21 in college, I assume you drink and probably smoke. How much of physical activity do you do? When last did you go see your doctor? Do you know your blood pressure level, cholesterol level, and levels? You can make a step in the right direction by going to see your doctor and knowing your levels. Cutting down on alcohol consumption, increasing physical activity, and increasing more vegetables in your diet. How do you know if you or a loved one is having stroke? Well, let me give you this. Be fast. Is their balance off? Are they having blurred vision? Is their face drooping on one side? Is their one arm weak? Are they having slurred speech? When did this start? Be fast. Call 911 now. If you see any of these signs, don't wait to go to the emergency room. Call 911. Remember, time is of essence and you only live once.